After studying so many different medical traditions or healing traditions, I recognize that each tradition has its own view, has its own scope of understanding, and its own toolbox.
Mhm.
And Chinese medicine does what it does, Ayurveda does what it does, functional medicine does what it does, traditional medicine does what it does. Each healing tradition has a merit. Each healing tradition is amazing. I mean, functional medicine and ICU, that ship had sailed. And
Right.
so traditional medicine is amazing at what it does, where it does.
I'm Dr. Bismah Irfan, a physician on a mission to help you break free from symptom management and step into a life of thriving health. Together, we will uncover simple, powerful ways to prevent disease, restore energy, and take control of your health naturally. If you're ready to stop managing illness and start building vitality, you are in the right place. Your prescription for vitality starts now. Welcome, Dr. Inna. Before we get into the science, I want our listeners to know your story. You were a successful hospital physician in ICU, specialty floors, and eventually a medical director. From the outside, everything looked great. What was happening behind the scenes? Can you tell us a little bit about that?
Well, first of all, thank you for having me. It's true, you nailed it. Everything was successful outside. And inside, it seemed like I was living a dream. I relicensed in US, I passed the boards, I was back to my fields that I absolutely loved. I was doing hospital medicine, which is always a cutting edge. And all my dreams as an immigrant came true, except somewhere in the process, I lost my health and I didn't feel good. It really started in my late 20s. And I really really good. So obviously nobody would suspect anything. But my energy was going downhill and I was losing hair and I couldn't sleep and I was anxious and I would wake up in the middle of the night for no reason whatsoever. And I couldn't fall asleep for 2 hours. And I was miserable inside. And finally, I think when I hit 30, I thought I'm not sick, I'm just not well anymore. So I went to primary care doctor and she was great and she really paid attention and there are no labs in the world and of course everything was normal. So that was the first time I heard that I think every woman hears, everything is perfectly normal. You get.
So, as a physician yourself, right, how did it feel like to be on the other side, to be the patient who isn't being heard?
Yeah. So it's scary. It's really disheartening. It's scary to be a doctor and not knowing what's going on with you. Because then you start questioning, am I authentic? I am saving lives in a hospital, and yet I cannot save my own life. And it wasn't bad in 30s, bad enough that I would think too long about it. It was just the very first time where I just wondered. And that was the very first time I also heard, well, you're 30 now. What do you expect?
Mm, mm,
I
mm.
always thought about my age until that phrase. And I thought, 30, like, what's special about 30?
Right.
Uh, I was busy physician. I had practice. I had family, so many other things. So I just moved on with life. I'm told everything is normal. I take it. As a doctor, I'm obviously trusting other doctors, and this is my colleague, and I know she knows what she's doing. So I moved on with life and I kept going. And I thought maybe it's true that at 30, you just feel different than you were at early 20s. But things kept getting worse. And for a while, I just sort of ignored it. But through the decade, closer to my 40s, it was becoming harder and harder to ignore. I mean, I had to drag myself out of bed multiple times, push an alarm clock. I had no energy by 10 a.m. If I had an opportunity to take a nap, I would, except I was in the hospital. So a coffee or black
Your
tea.
best friend.
Mhm. And then by 3 p.m., I was so done with my day, except I'm still on my shift. So again, more coffee and pastries just to stay awake. And I was tired to the point where vacations, and I love travel, vacations were a burden, and weekends didn't make it better. And in the morning, I would think tonight I will get to bed early and I will just get a really good sleep and tomorrow will be so much better. And it wasn't. Because first of all, by the time I finally got to bed, I couldn't fall asleep for an hour. And then I would fall asleep and I would wake up once or twice through the night, couldn't fall asleep. So next morning, I'm just as exhausted, if not more. And
Right.
by 40, I started forgetting things. And I used to have photographic memory. So now it was affecting my work and it was becoming just plain scary. And when I turned 40, I remember that day when I was around in an ICU in the morning and I looked up patients' labs as usual and I looked up patient's number, room number, just to verify. And I got up and I got into the middle of the hallway and I didn't remember the room number. That was like Alzheimer's patient
Frightening.
diagnosis. That was so scary. So I looked up the number, I have it in my memory, I found it, but that was serious. I mean, now I question, do I remember? Do I know what I'm doing?
Yeah,
So
that's
that,
eye-opening.
yeah, it was a really major eye opener. And my dark little secret, everybody around me was so healthy and vibrant and successful. And God forbid, in our medical field, everything is so competitive and you have to perform. I mean, in any professional field, you have to perform, you expected
Right.
to. I was just 40 and everybody around me was just healthy. I was the only one. So I had no idea what's going on with me. By then, I was absolutely sure either I have Alzheimer's or I have severe uncontrolled diabetes and it's blood sugar making me sore, foggy, or I have cancer somewhere. I was gaining
So
weight, so many things.
yeah, so I also, read your biography a little bit because you were experiencing all these things. However, you didn't accept it. You researched, you did Chinese medicine at Harvard, you did Ayurveda through Deepak Chopra Center, mind body medicine. I mean, what an incredible journey. So, what was the moment when you finally found that answer? And what were you looking for?
I was looking for solutions because, again, when I saw another primary care doc at 40 and I was told, you're 40 now, what do you expect? And all the labs came back normal. And I came to that appointment absolutely desperate. And I remember waiting for that answer. I was sure he will walk through the door saying, I'm sorry, you've got cancer. I was just whatever we find to be fixable because I just wanted my life back. And when I you're healthy as a horse, everything is perfectly normal. Whatever you're doing, keep doing it. It's working for you. That was
Mm,
true deep experience of, did you even hear what I said? Did you even hear why I came to you?
right.
And I was so disappointed. And we were colleagues, he knew me professionally. I knew him professionally. And so he really, I mean, he was very respectful and sincere, but he was like, look at your labs, they're all normal. What do you want me to say? And
Right.
understanding not feeling great, you're 40s, that's how people feel in their 40s.
Right.
And and I was like, if that's how 40 feels like, I mean, I can't wait to be 50 there. My whole life just going downhill, it cannot be right. It just did not sound right. And that day when after the appointment, I went back to the hospital for my usual work day. And I was around, and then all of a sudden, every room just spoke to me. I was looking at patients just like through the different eyes. And every room I went through, and stage Alzheimer's and cancer and amputations because of diabetes, I looked at them and I thought, it didn't start like this. It didn't start yesterday. 20, 30 years ago, they didn't feel right. They came to their doctors, they ran whatever labs they ran, and they were told everything is normal. Whatever you're doing, keep doing it. And here they are. And so all of a sudden, I was walking through room by room. I thought, which one is my future?
Hmm.
Not ready for that future. I
Right.
thought way more than that. I deserve way more than that. What I'm experiencing isn't right. And just because my doctor doesn't validate it or doesn't see it, or whatever labs he runs don't reflect what truly is going on, I'm not going to give up my life just because somebody doesn't know. And so
Right.
I recognized that it was actually that night that's called Dark Night of the Soul, right? And so I couldn't sleep and I was so anxious. And in the middle of the night, all of a sudden it dawned on me, I observed traditional medicine. I loved it. We saved lives. That's true. But I just all of a sudden recognized that the traditional medicine I'm serving has all the tools to help us survive. It has no tools to help us thrive. And that's what
Right.
I wanted. I didn't need survival. It's true, my labs did not reflect disease. I just didn't feel well. And I was not ready to sign up for just pushing through life day by day and getting worse every year and every decade. So I knew I had to find my answers for my own sake and for the sake of my patients, because all of a sudden I recognized everybody I was seeing in the hospital went through the same experience. Everything is great. Keep going. And here
Right.
we
So, what
with
did you discover first? Like, you have done a couple of different out of box trainings, right?
it.
So, tell me about that experience a little bit. What was the first step, and how did you reach the second step, and what did that look for you?
So I initially thought, well, if Western medicine doesn't have answers, Eastern medicine will, because it's ancient, it's wisdom tradition. So I decided I'm studying Chinese medicine. And of course, life is short. I always learn from the best. So I looked, and Harvard had a 1-year program for physicians on Chinese medicine. So I joined, I did a year of that. It was great. I learned a lot. I learned about energetic side of medicine. I learned about prevention, because Chinese medicine is very much about prevention. So I
Right.
learned a lot about tendencies and nutrition. That was my first experience of a bigger toolbox. It was very different toolbox. I mean, it's
Right.
meat rather than giving medications. We used herbs in Chinese medicine, which again to me is another tool. But the biggest part I took out of Chinese medicine is understanding how body works, basically body wisdom. And as I started applying it, I felt somewhat better. It wasn't transformational. It did not give me my life back. But I definitely, as I started to understand how body works, I definitely was able to make it better. But then again, I was after transformation. I wanted to go back how I felt at 27.
Yeah, why not? This is
So,
how we should be.
and I absolutely genuinely believe that it's possible. And I think that's where it all begins. And so I thought, well, if Chinese medicine doesn't quite explain everything, then Ayurveda will, because it's the most ancient tradition. And so I studied Ayurveda. Deepak Chopra had a course in San Diego, and off I went and I studied. And it gave me another level of understanding of nutrition. Most important, from Ayurveda, I learned lifestyle, basically lifestyle medicine and mindfulness. So that was a big introduction to sort of that whole mind level of medicine and how we make ourselves sick or well. And then from there, I thought I really want to have either a Western view of mindfulness and overall just mind-based medicine. And
Yeah.
sure, Harvard had mind-body medicine. So
I
Dr. Benson, the head of cardiology department for Harvard at the time, led the course. And I thought, he's a top scientist. And if he's doing it, I'm in. So I
Yeah,
started,
yeah.
and that's how I learned that mind-driven body follows the mind. Even Deepak
Uh-huh.
Chopra told us that body follows the mind. So it is
Uh-huh.
important to address. So I was getting all these tools, and I studied palliative medicine, which is complex, the highest complexity of medicine, and end of life. So there were so many things that went over so many years, and I was just driven, and everything I would learn would give me a little bit more tools, and it would also help me to feel a little bit better. But it wasn't until just by accident I landed in functional medicine conference.
I see.
That was not an eye opener. That was
Uh,
just a different universe. All of a sudden, I honestly felt this is why I went to medical school. This is what
uh-huh.
medicine is about, truly should be about. I learned about things. I remember first phase was I felt angry. I felt deceived because by
Uh-huh.
then I practiced the highest complexity medicine for 17 years. I was
Right.
trained in best institutions all over the world. I learned so many advanced techniques and strategies, and yet I never was taught in depth about nutrition and body's ability to cleanse and hormones and stress response. And it seemed to be
Yeah.
everything I learned was so foundational.
Right.
And so
Absolutely.
looking back, it felt like in traditional medicine, we're addressing the end stage of it, but we're missing the whole foundation. So sure enough, the end stage looks harsh.
Right. Right.
And I
So
thought,
what did that tell you about everything that you have been taught in medical school in residency, and now you're learning this part, right? And as you mentioned that this was such a big eye opener and you did all these trainings, how do you compare that with what you were taught and the box that you were kind of supposed to be in, and you broke the barriers and started learning about this side? What was that contrast like?
um, when I applied it to myself, because we are our first patients, right? I started simply applying it. And within days, brain fog was gone, and I was sharp and focused, and
Hmm.
memory came back. And within a
Wow.
couple of days, well, 3 months, my ideal weight came back. I was not trying to lose weight. That was the least of my issues. It just
Right.
sort of a sidekick. And all of a sudden, I was losing weight. I was vibrant. I had energy. I slept well. Every single problem I struggled with for 15 years, well, 13 years at least, all of a sudden just went away. And I wasn't doing any glamorous medications. I was not on medications at all. I was changing foundational things, what I eat, how I cleanse. I balanced my hormones. I looked at practically every aspect of healthy living. And there
Mhm.
was things I've done habitually that didn't serve me anymore. And that was the
Mhm.
biggest point I had and still have. And I teach it. Every decade of life has different requirements for wellness. And what
Right.
doesn't serve us at 20 does not serve us at 40. It takes us way down at 50. So every
Mhm.
day, the requirement for being well, you can be well in 90s and probably early hundreds,
Right. Right.
but you have to you have to give the body what it needs, and the needs change every decade of our life. And if we
Uh-huh.
just try to push through it just like the way we did in our 20s, and sleep is not important, and I can push it and I can push through and I can do it all, and I could, but I
Mhm.
crashed physically. And when I started applying functional medicine principles within 6 months, I remember that day in the morning, I was again getting ready for work, and I looked in the mirror and I just thought, I'm back. Like it was me again. And
How beautiful is that?
I was in my 40s. And honestly, at 49, I felt so much better than I felt at 30 and 35, not to mention so 40. So it's not about age. It's about giving your body what it needs to perform at your best. And when I lived through that experience, first of all, there was no way I could go back and lie to my patients that the only way to fix their problems is a pill. In fact,
Right.
it was clear and obvious it was not the pill.
Mhm.
Second, and I really could not, I could not lie to my patients. I had to face
Right.
that very spiritual choice. And secondly, very unexpectedly, all of a sudden, my colleagues, nurses, and doctors in the hospital started coming to me saying, "Hey, whatever you're doing, I want, I need
I
that."
see.
And they would
Right.
show symptoms, and they had exactly the same stuff I used to have.
Uh-huh.
And all of a sudden, like one after another, I finally recognized that dark little secrets that I kept, that everybody's great and I'm the one dying here.
Right.
And
Right.
it's not just my little secret. We all
Uh-huh.
keep that secret, or most of us. I mean, a lot of people who are hearing us now probably are recognizing that it's my secret too. I'm trying to
Uh-huh.
pretend everything is great, and I'm dying inside.
Right.
And
So
so,
the chronic disease, the concept is that in the world of functional medicine that we practice, we know that the chronic disease, even though it may have been diagnosed, at a certain year, but we know that this probably began 10 to 20 years back. So the most important question is, why do you think conventional medicine misses this window, or they don't look at it? And what is that thing that is going to help us the most, especially if, let's say, we are talking to practitioners or physicians? What would be that first step that they should do in order to at least acknowledge that maybe they're not seeing things on the labs, but that doesn't mean that it is all in the mind or it does not exist?
yeah, after studying so many different medical traditions or healing traditions, I recognize that each tradition has its own view, has its own scope of understanding, and its own toolbox.
Mhm.
And Chinese medicine does what it does, Ayurveda does what it does, functional medicine does what it does, traditional medicine does what it does. Each healing tradition has a merit. Each healing tradition is amazing. I mean, functional medicine and ICU, that ship had sailed. And
Right.
so traditional medicine is amazing at what it does, where it does. But traditional medicine is acute care medicine. I think where the problem begins when one tradition takes over the whole picture and starts telling everybody that this is the only way.
Right.
And yet it only has toolbox for certain things. In acute care, I still believe medicine in US is the best in the world, and I have to compare. I have something to compare. I practiced in different
Sure.
parts of the world. So it is amazing for what it does. It is the most advanced. And if God forbid I have something very severe, I want to be here in the States. But 94% of what we see in emergency rooms is actually not an acute disease. It's problems that we accumulated through the lifestyle, through the wrong nutrition, through stress that wasn't mitigated or balanced for years. And those things they're not fixed by antidepressants. They're not fixed by sleeping pill.
Absolutely.
We don't ask why it's happening. We subscribe to always depending on that pill, on that band-aid. And, there is nothing wrong with band-aids, but I'm using it as a tool short term to
Uh-huh.
allow wound to heal. And I would never subscribe to that depend on that band-aid for the rest of my life. I want to see why I scrape this area. And if I scrape it all the time, then what is it that I keep doing that's
Uh-huh.
really good for me, right? And so on
Yeah.
that level, you just understand functional medicine is a medicine of why. It's a medicine
Uh-huh.
of root cause. So when
Uh-huh.
someone breaks their leg, I mean, if they need surgery, they need traditional medicine. It's
Sure.
the right
Sure.
thing. But if somebody has osteoporosis, then when these
Uh-huh.
people come to me, I'm asking why. There are certain
Uh-huh.
food do it. There are certain, like a community will put them at higher risk. Why? Because it's inflammatory condition. Why is they inflamed? What is out of balance? Can we change to get them
Uh-huh.
back? So the problem stops to exist rather than constantly depending on medication with its side effects.
Right.
Uh,
And basically, so what I, believe that these medicines are basically just band-aid, right? They are not addressing why it happened. And if you will not address the why, then you will always continue to be using the band-aid. And there is place for the band-aid, but ideally, you should be working at the root cause level so that the band aid can finally be off and not continue to be used all the time, right? So, as a kidney physician, I see this pattern all the time. Having basically inflammation in the body, hormone disruption, cortisol, affected. And basically, it's the same story through different organs. How interconnected is the system in your lens?
Everything is connected to everything. So when I work with patients, we always start with foundation. And foundation is again what we eat. Do we flush out toxins efficiently? Our hormones balanced? And since the hormonal realm, I often see, I specialize in BHRT and bioidentical hormone replacement or optimization. And often I see people come in and they instantly want to address their hormones. There is nothing wrong with it. But more often than not, when I check their cortisol, their stress or survival hormone, it's very much off. And again, trying to fix the consequence without addressing the foundation is like trying to build the house on without a foundation or on a cracked foundation. It's just not
Right.
going to end well. And
Right.
so it's so important to start from the bottom, from the foundation. And foundation again, nutrition, lifestyle, sleep, which is part of lifestyle, ability to cleanse our body, ability to manage stress or deal with stress, restoring that survival system so we're not constantly in survival state, because when body is in survival state, we're inflamed.
Right.
You cannot be both surviving and thriving at the same time. By the
Absolutely.
body doesn't multitask. We have the solution multitasking. Reality doesn't multitask. We're
Yeah.
either
Yeah.
100% of the time, or we're thriving 100% of the time. And it's a different focus, it's different nerves, different hormones, different neurotransmitters. And when we're in survival state, body or actually nature doesn't care how it feels, it just feels for us to stay alive. And often it happens at the cost. And all of us suffering more or less with the same symptoms. I hear day in and day out, sleep issues,
Absolutely.
weight issues, digestive issues. Will have variants of that, and it has to be individualized. You can't just like develop one protocol, apply blindly to everybody. Somebody will be like
Absolutely.
better and somebody will not. But
Right.
so it's individualized. But the patterns of the universe have to be honored. And
So,
so
if someone is listening right now, right, and they're feeling exactly how maybe you felt, right, exhausted, brain fog, forgetting things, what is the first thing you will tell them to do? Just one thing, not the whole step or protocol, right? Because as it is individualized, what's that first thing that you would want them to do?
um, without knowing the story, an individual person, I would say 80%, I tell my patients, 80% of our success is based on what you eat.
Uh-huh.
So I would say the very, very first thing to look at, what am I eating?
Look at the
And
diet.
very, very, very basic stuff. Processed food is designed to make us inflamed.
Uh-huh.
And so if people are getting by on processed food, by definition, they hurting themselves. And so, before I go into intricacies of how broccoli works and how
Right.
food and this food and what needs to be removed, we eat quite inflammatory in the
Uh-huh.
modern world. And here in the States, it's quite prominent. And
Uh-huh.
a lot of my patients with autoimmunity will go overseas for a vacation. They'll come back and they will say, I ate everything and I felt good. And then I got on my United flight home. And after lunch, I felt home.
Absolutely.
I feel good. So unfortunately, these days, and it's changing now, and I just really pray for this change to be fast. But
Uh-huh.
we're educated about what we put in our mouths. And when you think of it, whatever gets into your mouth is either beneficial and it helps your body, it nourishes your body, or it's a toxin and body has to work really hard to get rid of it. And it
Uh-huh.
requires energy. And so I think the very foundational, very basic, look at what you eat. And if it comes from the box or a jar,
Avoid
remove,
that. Right.
uh,
Right.
go granular or on specific foods, again, without knowing a person in a
Right.
store.
Right.
I would say
Absolutely.
everybody would benefit from removing. We get way too much sugar in our diet and a
Uh-huh.
lot of hidden sugar. And again, sugar is a fire. and there is only so much fire your body can take. And so if
Absolutely.
one thing to change in your nutrition, go sugar free for 3 weeks, and you'll be surprised as you experience.
Wow, I love that. That is pretty powerful. Because you know how everyone talks about, oh, do dairy free, do gluten free, and all these different frees, and everyone is different, and everyone may, benefit from that or this or something like that. But from what I'm hearing from your side is two things. One thing is processed food, so that means remove the things that is harming you, and the other thing is just try to see how your body responds just by going sugar free for 3 weeks. And 3 weeks absolutely is doable. And what I love about 3 weeks is that it takes 21 days, right, for your gut to repair itself. So if there is any kind of inflammation that the sugar is bringing in your body, then in 21 days, which is out of or free of sugar, you will be able to repair that if this is something that is affecting you. And you will be able to see the benefits of whatever intervention you're doing. So I also want to touch on peptides. We will go deep into the peptides in our masterclass, but because you're from Russia and peptides, were basically, I don't know, developed, but basically they started in Russia. So tell me a little bit about maybe your excitement and your maybe personal use of peptides, and what does that mean to you?
It's a tool.
Mhm.
Um, right? So it's a it's becoming rapidly becoming very popular tool. I love peptides. They're very powerful in the right setting. I just want to say I've never, in 34 years of clinical experience, I've never met one tool that overpowers everything else. So there is not a single tool that is everything. And the way peptides are marketed right now, fortunately or unfortunately, it's like the solution. Nothing is the solution. Peptides are regulatory.
Uh-huh.
Peptos means digest in Greek, so a peptide is just short protein. And
Uh-huh.
short protein chains are regulatory. So rather than being food for our bodies, they actually go into cells, and cells have receptors for them. And so peptides are regulatory.
Uh-huh.
It's a high level of regulation because it's intracellular regulation.
Uh-huh.
Because the receptors for peptides, the sensory things that connect to
Uh-huh.
peptides, are sitting inside on the cell membrane.
Uh-huh.
And so peptides regulate what happens inside every cell of our body.
Uh-huh.
And again, going back to the concept of foundation, peptides to me are sort of a golden roof. It's beautiful. But if you don't have foundation, you don't have a house,
It's a collapse, right?
you don't have a floor.
Right.
So peptides add a whole new level of wellness when foundation is in place. And so when the foundation is built and regulation of that foundation is established, which is hormones,
Right.
now you go to the whole next level of regulation, intracellular regulation, which is peptides. And when foundation is in place, peptides can do a whole next level of magic, and they can
Absolutely.
separate how we make energy, how our brain works, how we make energy inside those mitochondria, energetic energy stations in every cell, how we sleep, how we perceive the world, how we regulate. So
How
they,
about, yeah, I love that. Tell me about your personal use of peptides. Have you used any peptides personally, and what have you seen as a result of maybe using that on top of the foundations that you've already built for yourself?
I tell my patients, I will never ask you to do anything that I haven't done. Uh,
Right.
so I'm my first patient. I test things on myself. So very basic. Years ago, when I entered menopause without realizing what's happening, the first entrance into menopause was rotator cuff injury, which is actually classic. When your estrogen drops, everything becomes stiff. And
Mhm.
for women, it's super common. Rotator cuff injury with usual workouts that used to be just fine. And with
Mhm.
rotator cuff injury, usually what happens, you get PT and it's very slow healing, and there is a very high risk of frozen shoulder. In fact, most women will end up with frozen shoulder, even though they're doing physical therapy. And frozen shoulder takes up to 2 years to resolve. And
Hmm.
so
Wow.
with rotator cuff injuries that I got without recognizing what's happening and doing traditional approach, it was painful. I lost range of motion. I mean, I couldn't dress myself for a while. It was really painful. And at some point, I decided that's how I went back to peptides. I haven't used them for ages because here it's not really common. And so they were not part of my practice. It was just for myself that I decided to try. And I did BPC, and in 2 weeks, my frozen shoulder started to unfreeze very rapidly. My PT said, finally, physical therapy works.
You're like,
Um,
yay, let them be happy.
yeah, so I did 2 weeks initially, and it felt so much better. I did another 2 weeks, and
Yeah,
like
that's
4 weeks later, I did not have frozen shoulder anymore. And I mean, my ligament healed. I paid for MRI just to see it because I needed
sure.
to go to myself.
Yeah.
And sure enough, it was completely healed. It was partial tear. It was completely healed. I absolutely loved it. And then I forget 6, 7 months later, I ended up with second rotator cuff. I didn't
I
wait.
see.
So that rotator cuff injury only lasted 3 weeks.
Wow.
So
Wow.
because when I didn't even go into frozen shoulder. I started it right away. So
I,
peptides are great for muscular injury. Later, when I started looking into peptide field and learning more and using what's available in the States, my energy changed. Again, you can feel great. And if everything is addressed and you add peptides, you get whole new level of wellness. You can optimize your energy. I did not have trouble sleeping. I mean, I regulated myself by then very well. But for patients who have difficulty sleeping and just lifestyle modification, hormonal optimization, and lifestyle is still not enough,
uh-huh.
mostly executives who just they have so much higher requirement for performance. There are peptides that will optimize your sleep, your focus. Once people go through menopause or andropause, libido suffers, which means relationship suffers. There are some peptides that actually can improve libido and sexual desire and performance. And I mean, oxytocin is hormone of relationships that our body makes, except with age, we make less and less. So oxytocin
Mhm.
is a peptide. If you
Uh-huh.
say insulin is a peptide, it's a hormone,
Absolutely.
but
Mhm.
structure-wise, it's a peptide. So really, the introduction into peptide therapy in traditional medicine happened in 1930s.
Mhm.
And insulin saves lives day in and day out. So
Mhm.
of different peptides and they work differently. And again, a Atlas Foundation is in place. Peptides give you a whole new level, longevity,
Okay.
performance, body composition, sleep, stress, energy production, all those. You can
I
optimize
see.
those are with peptides. So it's really your
Thank you
life
for sharing.
still.
Yeah, thank you for sharing. So let's just quickly turn our tracks. And I wanted to talk about I think you have developed this four-step core method, and that has helped hundreds of patients get their lives back. Can you give us a little glimpse of what it looks like? Just maybe, what does core four stands for? What does it include? And then we will dive deeper into that when we talk about it in the masterclass.
Sure. Again, going into foundations, our proprietary methods or roadmaps that we use for patients has 7 major areas addressed. And those that are for people who want longevity work or high performance work. However, foundation of all that 4 things, and I called it core method, and
Mhm.
it's clearing or flushing toxins. It's optimizing hormones, it's healing the gut or restoring, reviving the gut. And it's addressing lifestyles, the habits that either serve you or thank you. And so those are the 4 pillars that we address with every single patient. And
Mhm.
everybody different, they have different life story, different symptoms, different health goals. And so the program for every person becomes individualized, but those 4 core principles have to be addressed in order for anything to work well and most importantly stay well, because we
Uh-huh.
can all optimize somebody to feel great the next 3 months or 4 months, but I want those results to last. And so those 4 core principles: clear the toxins, optimize hormones, restore gut, and enhance lifestyle habits.
So basically, that's the foundation, right?
As a foundation.
Okay. So one quick question. What does wellness means to you as a physician in one sentence?
Vibrant.
Vibrant.
Feeling vibrant. You can say living my best life. You can say feeling my best. Sometimes I say I wake up in the morning, I feel like the world is mine. That's my formula of wellness when,
I
when I
love
don't
that. So what message would you leave with someone who has been to doctor after doctor? They've been told they're fine and is basically by this time they have started to lose hope. What would your advice be to them?
never lose hope, first of all. We designed beautifully. My pathology professor used to say we are fearfully and wonderfully made. It's absolutely true. Our body has innate endless potential for healing. And if something doesn't feel right, don't ignore it, don't push through it. And if somebody tells you it's normal, just don't buy that. I'm sure there are a lot of things I don't know. So
Uh-huh.
I think it's a maturity of and mastery of practitioner to say, I don't know, you need to see somebody else. And if the practitioner you are seeing, and I don't care which field, whether it's functional medicine, Chinese medicine, or traditional medicine, if somebody tells you, if you're not feeling well and somebody tells you it's normal, maybe it's their normal. It doesn't have to be yours.
That's beautiful.
Deserve to feel well, there is always solution. And if whoever you're seeing is not able to give you that solution, find the one who can. There are a lot of different practitioners out there. Never stop. I was searching endlessly for years. I just knew I deserved it. I wanted it. And I always remember it. I only have one life to live. I was not going to settle for mediocrity. So we all deserve
Okay.
it. We're all able to feel our best. And if it feels less than the best, look for somebody who can guide you to that.
I love that. I feel like you deserve to be healthy. You deserve to be vital, right? And anyone who tells you that this is your new normal or this is what you're going to live with, that is where you have to stop, take a step back and be like, okay, is there anyone else who has answers to it? And the most beautiful thing that I loved is maybe the mediocrity that they have or they think that this is the new normal of 40 or 50 is not or does not have to be the same for you. So tell our listeners, where can they find you, how they can connect with you, how can they work with you, what do you do?
So I'm in Denver. I'm an internal medicine physician by trade, and I've done 26 years of traditional medicine. For the last 7 years, I'm only doing functional medicine, and I specialize in longevity and wellness and hormone optimization. I'm located in Denver. Most of our patients live in Colorado. Many patients travel to see me. We have some patients from different states coming and seeing us. We have some people coming overseas. So happy to help you. You can find us on the web as midlifewellnessinstitute.com. And you can always sign up for free discovery call, and then we can see if I can help you with what's going on and we're doing medicine very differently as you now getting a gist. And so if that's what you're looking for, then we're happy to help you. And I'm not alone. There is whole army of us. You're doing the same in your
Yeah, I love that. Dr. Ina, thank you so much for reminding us that normal labs doesn't mean normal life and that midlife is not a decline. It is an invitation. For those of you who want to go deeper to learn about the specific lab markers Dr. Ina tracks, the hormone protocols, the gut health strategies, real clinical cases, and how she applies her core method step by step, we have an exclusive masterclass where we will cover everything. You can get the link down below. I am Dr. Bismah Irfan, and this is Kidney Wellness, where every conversation brings us closer to whole body healing. Thank you.
Thank you so much for having me.
If this episode spoke to you, please subscribe and share it with someone who is ready to take control of their well being. Also, please consider leaving a review. It really helps people find the podcast. For more expert insights and resources, follow me at drbismah.com. Your health, your power, your vitality. It starts with you. See you next time.